Mental health of students front and center again in the town of Killingly. State leaders grilled Killingly's Board of Education over allegations they're not meeting student mental health needs.
Channel 3's chief political reporter Susan Raff was at today's hearing and is joining us live with the details. Susan.
Aaron and Mark, there was certainly some fiery exchange between Killingly's attorneys and the State Board of Education. Now, a complaint was filed with the state after Killingly's Board of Education voted against a plan to have a behavioral health center in their high school.
And I would like you now to start.
After lots of objections, Killingly's attorneys started answering questions. The State Board of Education launched a 6-month investigation into a complaint filed by parents and students. Killingly's Board of Education is accused of repeated failure to address students' mental health needs.
They haven't responded to the need. If you don't acknowledge the problem, how can you address it?
Christine Rosati's son is a high school senior.
Help us, help our kids!
Parents and students have spoken out. Killingly's Board of Ed got money from the state because students' needs increased significantly during the pandemic. But the board still rejected a plan to put a school-based behavioral health center inside the high school.
The allegations are serious but false because the Killingly Board of Education and its administration have been handling the needs of students from the beginning.
Since then, Killingly has hired a provider to offer those services, but students must notify their parents in order to get those services.
The main sole reason that I did leave Killingly High School is for my own mental health.
Julie Revelise is a former student. She says parental consent can prevent some kids from getting the help they need.
The problem is starting from home for some of them, and they're struggling, and if they have to get their parents to consent to this, and if the parent is saying no way, they're not going to get the help they need. They're going to struggle forever.
A survey taken during the pandemic was alarming.
We found approximately 66 students said they had suicide plans. There were many more who felt sad, depressed, who had engaged in self-harm.
Another concern that we heard raised at today's hearing is that the current provider can't handle the number of students. Now, students say they're either told to wait or to come back at another time. There are 2 more hearings, we're told, and then the state will decide if Killingly is compliant with state requirements. Susan Raff, Channel 3 Eyewitness News.
Susan.